If your child has suddenly developed intense anxiety, obsessive behaviors like repetitive hand washing, or uncontrollable motor or verbal tics, you may suspect that something neurological is wrong. But oftentimes, standard medical testing comes back normal, and that leaves you feeling dismissed, without answers, and honestly a little bit crazy. But please note there is light at the end of the tunnel, and the cause could be something called PANDAS or PANS, two complex disorders tied to infections where the immune system gets confused, and that triggers psychiatric symptoms. The reason these two health challenges are extra tough to understand is because they also create significant imbalance within the brain and the nervous system, which means that the proper care approach needs to target both the immune system and the nervous system at the same time. Getting the proper diagnosis is key here, but relief is possible with the right multifaceted care approach. Today's video is for parents desperate to figure out why their child's personality and behavior changed virtually overnight when other diagnoses just don't fully fit the story. In this video, you're going to learn what distinguishes PANDAS and PANS from other neurological conditions and how strep and other infections can throw the immune system off course and how that can lead to sudden anxiety and OCD from out of nowhere. These vicious cycles, they require both immune-based and nervous system support, and we're going to go over the steps to uncover the root causes, to collaboratively restore calm, regulation, and balance within the body once again. So, what is PANDAS? It stands for Pediatric Autoimmune Neuropsychiatric Disorders Associated with Streptococcal Infections. Long name, right? Let's break it down piece by piece. First, autoimmune means that the immune system mistakes healthy cells for dangerous invaders, and then it unleashes inflammation that damages tissues and organs. And with PANDAS especially, these antibodies created to attack strep bacteria also interfere with signals to and from the brain. Second, streptococcal. That refers specifically to streptococcus bacteria that are responsible for illnesses like strep throat and scarlet fever that then spark the autoimmune cascade. However, PANS, or pediatric acute onset neuropsychiatric syndrome, can stem from other infections like influenza, mycoplasma pneumonia, or even food poisoning. But the suddenness and severity of the symptoms are very similar to PANDAS. Both PANDAS and PANS ultimately impact neurological function, specifically the basal ganglia, and that coordinates cognition, emotion, movement, and behaviors, and also the vagus nerve, which coordinates the body's ability to rest, calm, digest, and regulate. This is why all of the neurological symptoms can appear so fast and bypass detection on common medical exams. Once things really set in with PANS and PANDAS, it's not just inflammation that needs to be addressed, but also two things called subluxation and dysautonomia. Subluxation occurs when there's excessive and stuck tension in the neck, the upper back, and other areas of the neurospinal system that leaves the sympathetic fight or flight nervous system stuck on overdrive. Dysautonomia is a foundational component of these disorders as well, which is a significant imbalance of the autonomic nervous system and the vagus nerve. We can detect and measure this dysautonomia and nervous system dysregulation with incredible insight scanning technology here in our office, especially the HRV or heart rate variability scan. Helping a child with PANDAS or PANS infections requires that first, the underlying neurological dysfunction and dysautonomia are addressed with neurologically focused chiropractic care. We offer an intensive program where many adjustments are made each week in the early stages. And this is so important because if the nervous system stays out of balance and sympathetic dominant, then both the immune system and the digestive system will be shut down, suppressed, and unable to fully rid the body of those infections, even with the most perfect functional or integrative medical approach, diet changes, detoxes, and supplement support, which are, of course, all essential to complete the healing process in these cases. With PANS and PANDAS cases, it is imperative to build a complete care team for your child. So often, the traditional medical route leaves parents feeling dismissed and without answers or any effective action steps, and too many heavy medications that can just drive the infections and the dysautonomia further down into the system. We encourage our families to build a multi-layer care team of neurologically focused chiropractors and functional or integrative care professionals. Please know there is hope. Both PANDAS and PANS can be put into remission so that children can regain their happy, resilient selves. The key is persistently digging for answers and adding in the multi-layered care approach to address the root cause and the neuroimmune dysfunctions in full. So to take the first step in adding nervous system regulation care to your child's team, either comment below or send us a DM to schedule a consultation and learn more about how we can help.